Syndrome. Achard-Thiers Syndrome. What are the other names of this condition? The other names of Achard-Thiers Syndrome are diabetes in bearded women, diabetes in bearded women, and diabetic bearded woman syndrome. Diabetes in bearded women and diabetic bearded woman syndrome. Now let us see what is Achard-Thiers syndrome. Achard-Thiers syndrome is a rare, uncommon, hormonal disorder that primarily affects post-menopausal women. It is also known as diabetes in bearded women. The syndrome is characterized by the presence of following features. Diabetes, type 2 diabetes, that is high sugar level. Number 2, excess androgen. Number 3, hirsutism, that is excessive growth of facial or body hair in women. Number 4, deep masculine voice. Number 5, acne. Number 6, enlarged clitoris. Number 7, obesity. Number 8, hyperplasia or adenoma of adrenal gland. The adrenal gland are hyperplasia or adenoma of the adrenal gland. This Achard-Thiers syndrome appears to be transmitted within the families, but exact mechanism of genetic transmission is not yet discovered. The diagnosis is based on the symptoms manifested by the disorder. The treatment includes managing diabetes. Now, who gets Achard-Thiers syndrome? Postmenopausal women are primarily affected by Achard-Thiers syndrome. There is no racial, ethnic, and geographical predominance. Now, what are the risk factors for Achard-Thiers syndrome? The risk factors or predisposing factors for Achard-Thiers syndrome are: number 1, postmenopausal woman. Number 2, obese or overweight woman. It is important to know that having a risk factor does not mean that one will get the condition. A risk factor increases one's chance of getting condition compared to an individual without the risk factor. Some risk factors are more important than others. Also, not having a risk factor does not mean that an individual will not get the condition. It is always important to discuss the effect of risk factor. Now, what are the causes of Achard-Thiers syndrome? That is etiology. Achard-Thiers syndrome appears to be transmitted within the families. Diabetes is the main cause for this disorder, and this may be due to use of certain chemicals and drugs such as thiazide, diuretics, adrenal corticosteroids, and hormonal contraceptives. Then physiological and emotional stress. Now, what are the signs and symptoms of Achard-Thiers syndrome? The signs and symptoms of Achard-Thiers syndrome are: onset of diabetes, frequent urination, excessive thirst and hunger, weight loss. The signs and symptoms caused by overproduction of androgen may include hirsutism, that is development of excess body hair on face, chest and back, receding hairline, deepening of the voice, enlargement of clitoris, infertility, obesity, oligomenorrhea, infrequent or very light menstrual period, amenorrhea, absence of menstrual periods, facial hypertrichosis, that is excess hair on the face, adrenal cortical hyperplasia. Now, how is Achard-Thiers syndrome diagnosed? Achard-Thiers syndrome is diagnosed by following methods: complete physical examination with thorough medical history. Diagnosis is based on the symptoms manifested by the condition. The disorder can be confirmed by 2-hour oral glucose tolerance test. Blood levels of androgen, estrogen and hemoglobin A1C. Complete blood count. Thyroid function. Liver function test. Ultrasound scan of abdomen, CT abdomen. Now, what are the possible complications of Achard-Thiers syndrome? Complications of Achard-Thiers syndrome are amenorrhea, hypertension, osteoporosis, brittle or weak bones, atrophy or sclerosis of the ovaries or abnormal ovaries, pancreatic defects, abnormal liver function test, liver cirrhosis. Now, how is Achard-Thiers syndrome treated? The various treatment methods for Achard-Thiers syndrome include diabetes may be managed through proper diet or intake of insulin or other related medications such as sulfonylurea, meglitinides, bioguanides, alpha-glucosidase inhibitors, thiazolidines, then cosmetic measures such as waxing and electrolysis for removing excess hair. Hormone replacement therapy is often prescribed for postmenopausal women with Achard-Thiers syndrome. Anti-androgens can also be used to treat of androgen excess. Hormonal therapy to rectify endocrine imbalances caused by systemic diseases. Now, how can Achard-Thiers syndrome be prevented? Maintaining the correct body weight is important. Avoiding drugs that may cause diabetes. During pregnancy, care should be taken to control glucose level and ensure proper weight management. Reducing cholesterol and triglyceride level can also be beneficial. Reducing smoking to help avoid complications and prevent heart disease. Dietary education and weight reduction. Regular exercise will also help to prevent the obesity. Now, what is the prognosis of Achard-Thiers syndrome? With proper and effective treatment, the prognosis of Achard-Thiers syndrome is very good. Maintaining normal glucose level will help in preventing complications such as retinopathy, nephropathy, neuropathy. Controlling diabetes, blood pressure, and reducing or stopping smoking can result in lesser complication and a better prognosis.